Well, just a few days into Lung Cancer Awareness Month, Catholic Health is just debuting a new tool to help with diagnosis. The Ion robot can perform a minimally invasive lung biopsy, giving doctors a non-surgical way to better identify lung cancer and really to do it faster, giving patients quicker access to the treatment that they may need. Dr. Mark Jajkowski is Director of Thoracic Surgery at Catholic Health, and he's live with us here tonight. I appreciate you coming in on an important day here.
Thank you. Thanks for having me.
Tell me about this piece of machinery. And, you know, it seems like especially in medicine, things are constantly evolving, right? You always want to have the latest and greatest, and this seems like a significant addition.
Right. So this is technology that's relatively new. Navigational bronchoscopy has been around in different forms. This is the first one that uses computer-generated pathways to direct a tiny catheter out to peripheral areas of the lung where you're able to take samples of small lung nodules that may not be accessible by other means.
Wow. And the whole point of that is you want to be as minimally invasive as possible, right? But I mentioned there too, and I read this when I was looking into the device, it also gives you quicker and it sounds like better, more detailed results. Is that right?
Yeah, so you're by going from inside, you have less risk of complications from taking samples from inside, because the other way to do that would be from putting a needle from outside the lung inward, actually poking a hole in the lung. So going from inside gives you a little less risk of potential complications, but also by bronchoscopy at the same setting, we're able to also assess patients' lymph node status if they do have a lung cancer, which is important for staging purposes and directing the next steps in care.
We know how devastating a late-stage lung cancer diagnosis can be. This is Lung Cancer Awareness Month. I know that screening is so important, especially for people in these high-risk categories. This is an important month for people in your field, right? What should the public know about lung cancer and the importance of screening?
Yeah, so, you know, the number one is that lung cancer has no symptoms in early stages. Typically, symptoms are not encountered until you have spread somewhere outside the lung. So by that time, usually very late stage and not curable. You know, lung cancer screening is important for people who are at high risk because we find small nodules, a lot of times less than even a centimeter, which then can be biopsied minimally invasively by this new technology, and then treated surgically, again by robotic surgical techniques, minimally invasive, with a very high rate of cure for very early stage lung cancers.
I probably only have about 30 seconds left, but for somebody watching, I mean, if you can tell someone, hey, we can do this biopsy and we can get an answer as minimally invasive as possible, I mean, it's about convincing the public, hey, come in and do this, right?
Absolutely. People are, you know, some people don't want to get screened because they're afraid that you're going to find something, but the reason you're getting screened is to find something to take care of it, rather than waiting till it's a problem where it can't be taken care of.
Yeah, so important. Dr. Jajkowski, Director of Thoracic Surgery at Catholic Health. Great to see you again. Thanks so much for coming in.
Thanks for having me.
Appreciate it.